Welcome everyone to the August 10th, 2020 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Whoops, Dan Finn, aye.
Austin Magnan.
Austin Magnan is here.
All right, and we know Josh couldn't make it. He sent an email yesterday. Then staff, when I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
All right, and then anticipated speakers on the agenda or participants, please respond in the affirmative when I call your name. Phil Legere.
Phil Legere here.
All right, and then Pat Bruckman.
Pat Bruckman here.
Okay, thank you. I would like to open the meeting. Can I get a motion to open the meeting?
This is Dan Finn. I'd like to make a motion to open this meeting.
And then a second.
This is Austin Magnan. I'll second that motion to open the meeting.
All right, and then our roll call is, as always, of late. You know, we have to state our name and stuff, so.
Yep, Dan Finn, aye.
Austin Magnan, aye.
Karen Gwiazdowski-Govin, aye. All right, so good evening. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we've been advised and directed by the Commonwealth to suspend public gatherings. And as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment if there is any on any of our topics, if there is any public actually on the Zoom. For this meeting, the Grafton Board of Health is convening by video conference via Zoom, as I mentioned, as posted on the town's website, identifying how the public may join. Please note that the meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything that you broadcast could be captured by the recording and seen by the public. All supporting materials have been provided. Members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. All right, so we are now turning to the first item on the agenda, but before we do so, allow me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce each topic and speaker on the agenda, if there is a speaker for said specific topic. After any remarks have been concluded by the speaker, I go down, the line of members if anyone has any questions or comments. And then obviously friendly reminders with any type of webinar or Zoom meeting is to mute your phone or computer when you're not speaking and then to speak clearly in a way that helps generate accurate minutes so people can hear any responses or comments that you make. Let's see. For any response, please wait until the chair yields the floor to you. And state your name before speaking. And then if there are any items for public comment, they can be submitted by the public in the Q&A function of Zoom. And we'll read any public comments that may come through. Nothing has been received in advance of the meeting, but anything that does come through, we can address during said meeting. And then any votes that are taken during this meeting will be conducted by a roll call vote. So all that being said, now we can turn to our first topic on the agenda, which is the Alliance update. So, Phil?
Yes. I just got home. I'm in my truck, so I'll give you some. You should have received our Alliance monthly. I can't really speak to the other ones, although if you have a question, certainly you can try. As far as environmental health. We're just trying to keep up with the latest and best guidance coming out from the governor's office. So we had a call this morning. We did talk about the latest guidance with the gatherings going from 100 to 50 outdoors. Starting tomorrow, we have another call tomorrow. So I'm sure there's going to be some questions and answers from that. I actually did receive a guidance document, which not sure if I sent it back, but it's got all the information about prepared food. So the biggest thing on the prepared foods is pretzels and chips don't count. And that's basically what we talked about today. So I'm sending that now forward out to you today, right now,
Thank you.
which then can be forwarded around also. So, okay. And then I'm onboarding our new person today, Micah Wando. So we're out in the field and doing all the prerequisites, computer, phone, those kind of things, ID. So he's on board and will continue to be onboarded throughout the week into next week. I'll try to bring him around when folks are around, just so you can at least meet him. Beyond that, unless you have anything really specific, I'm just going to babble at this point. So,
Excuse me, Phil, this is Dan. Dan Finn.
yeah,
Was it Micah? Is that the person's name?
yeah, Micah,
Okay.
Micah, Micah.
Okay. And then were Josh and Oscar, were they like interns? Students?
Josh and oh no, Oscar and Joshin. No, they
No,
weren't.
no.
They weren't interns. They were actually community health persons.
Okay.
They're at UMass, furthering. Joshin's going for a PhD in nurse practitioning, and Oscar's going for a nurse practitioner also. So,
Okay.
Joshin, no, either one weren't
I was just
interns.
curious.
So.
That's good. The staff, unfortunately,
Yeah.
staff is 2 down and one up. But
Well, community health team, yeah, we got that. Joshin was doing the tobacco piece, but that has been posted. We are getting a CDC environmental health person, 20 hours a week till February. That's through a different program.
right.
We're doing some interviews. We should have that person. And the nursing's getting a contact tracer. They're getting 2 people. We're supposed to get 1.
Yeah.
But interviewing, hiring, onboarding is a job in itself, as
Right.
anyone that's been involved knows that. So
Right.
I'm just happy to have Micah on board, and we'll go from there. It's like any business, any organization. Can only wish them luck. I mean, as they continue their path through life, can't begrudge them trying to further their education. That's for sure. So
Yeah.
sad to see anyone go.
It was nice.
But we
nice to
can't
get-
even sign. We can't even sign a contract, with them.
Right.
You hire them, and it's not like you can sign. Oh, you're signing a 3-year contract. You can't do that.
But it was nice to get some
Um,
grant money from Medtronics too. So,
Yes. But again, these folks that are coming in, we have to onboard them, find them places to work, get them up to speed, so that's a whole job in itself. So we try to do the best we can with that. Micah will be, he'll be on, he'll be in the field quite soon, doing food inspections, so I have no problems there, I don't, you know. So anyways, anything else specifically?
Nancy did just email us 15, 20 minutes ago, the food inspection list. It looks like Danielle has been pretty active, covering a lot of ground. I don't know if you have that list.
Yeah.
I think there was only one that I saw that was an exception about number 9, Wong's needing a reinspection. I don't know if you know anything about that.
What was that one you broke down?
Yeah, Wong's needs
Oh, Long, yeah,
reinspection.
she was going, I think she went back, I'm not sure. She was off today, but, she's pretty good on going back as needed. I'm pretty sure she went back,
Mhm.
but I mean, without getting into specific details, there's a lot of different operations going in any Asian restaurant, because again, there's not a lot of prepared foods that come in. They chop everything up. Whether there's veggies, chicken, beef, fish. So there's a lot of different activities going on at any given time. So depending on when you're there, those kind of things, re-inspections are called for. So I don't have the specifics there.
No.
But Asian restaurants, again, there's a lot of different activities going on.
They're complicated.
Well, it's just not, you think, you know, pizza places, we mentioned that today. I mean, they have a lot of prepared foods. All they do is take it out of the freezer, pop it in, you know, a microwave, or they have a deep fryer, they just pop it in there for a little bit, boom, it's ready to go. They're not cutting the chicken up, they're not making the breading, they're not putting, it's all comes in a box. So it really depends. Asian restaurants do a lot of hands-on, so that's where the repeat inspections come in.
Great, thanks.
Anything else, Austin? Any questions for Phil?
Nope, no questions for me.
All right. Thank you, Phil. Since Pat has been so gracious to join us for blue discussion, and we can also pick her brain on the school part of it, I was thinking, as long as no one objects, if we can move the influenza clinic topic up and then also the school topic up before we go through the rest of the topics. So that way, since we know she, it's kind of jumping on at our request and is not used to having to sit through our meetings.
Sure.
All right, so influenza clinics 2020-2021 flu season. We had started talking about this the last monthly meeting that we had. We had pre-booked doses, and then we started to do the whole brainstorming around, could we use the gym? What about the senior center? Could we do maybe a drive-through option as a good practice, potentially down the line if we're going to be doing, say, COVID vaccines? Of course, there's always, weather concerns and also not having school at the time. And then also, I know there's been some back and forth around supplies also that we need. Anything else, Nancy, that you can think of that I didn't just kind of toss out there from at least the initial discussions we had?
No, Becca sent, well, actually, I sent Becca a list of what we would need. Pat, you gave me some supplies also. I just had a concern about the gym holding everybody. But if we do it by appointment, like we do in the hallway, I think it might work.
I think the gym is a viable option, especially if we do appointments. It will allow us to socially distance people who are waiting to get their shot, people after they get their shot, and will allow for one entrance and one exit. So that is a viable option. I know in the past when we used the gym, it was a little bit difficult um, for people who had some mobility issues because of the distance. But again, this time we need the spacing, so that's something we have to consider. Most certainly we could consider a drive-through option, but again, that could be, you know, a little more difficult, you know, with most of the seniors maneuvering, you know, getting a bare arm in the car, et cetera. Could be a little bit difficult, but that's also an option. Again, it will depend on what guidance is when we finally get the flu vaccine. The only other concern is we used to do a clinic at the middle school and at the high school. And now that you're going to be having, excuse me, 2 cohorts for those flu clinics, we would probably have to consider figuring out what to do with that, especially if some people have the remote option and decide that they don't want to come into school. How we could figure out those clinics. We could have 2 days, one for cohort A, one for cohort B, and then figure out, you know, as far as the students who are staying home, how they would like to do that, or they can just avail themselves, because of their age, they could avail themselves of a pharmacy. The elementary school clinic, we always held that after school hours in one of the community room, all-purpose room at one of the elementary schools. That still is a viable option. Again, we'd have to be concerned with social distancing, mask usage, et cetera. But again, we could also make appointments with that. You know, anything is doable. It's all dependent on guidance and what the cases look like in the fall.
Yeah, I know it's hard. It's like, you know, we've been talking, whether it be the elections, town meeting, flu vaccine, you know, way in the future COVID vaccine. And it's all like, well, here's the current guidance, but we don't know what the world's going to look like.
Correct.
Come October town meeting or come flu shot season. Oh, none of us can predict the future, unfortunately.
No, and again, even with the guidance, and I'm sure Phil may have said this to you, everything is nuanced. You know, you have guidance, but you really need to ask very pointed questions and gather very specific information to make a determination on certain things.
And I think the other key thing is going to be volunteers. It might be worth reaching out to Mary Ann and seeing, even though we don't have a date yet, just to have her throw it out there and tell her we're going to need whatever, a dozen, I would think, people, whether it's taking record keeping or keeping people spaced out and directing or whatever, as well as giving the flu shots. But
Right. And we have to take into consideration that some the usual volunteers, because of their age or medical conditions, may not feel comfortable being in a situation with a lot of people for several hours.
right.
Nancy, questions, thoughts?
Mm,
Austin?
no, just trying to figure out the latest possible date that we could put this out to the public without the state changing it in between. So I guess that's
Well, Nancy, I mean, depending on when you get the vaccine, I mean, we could plan this and have it up and running. I mean, we could do it in a week, as long as we
Okay.
have people holding on to, you know, dates, knowing it's going to come up. I would think we could get it done fairly quickly, because most of the any forms we have will be posted online. I have the mandatory training with Commonwealth Medicine Thursday, so that'll be another thing that will be done. I'll, you know, have any updates to the forms that we need, and I can send those to you quickly.
sure.
Great.
We
I
get it
just
all
have to check with.
quickly. Would we have enough
ahead.
time to plan the appointments for people? Because we want to have enough time for people to sign up for their whatever time they want to come, just so we don't have everybody showing up at once.
Well, normally Nancy has that fairly under control.
Okay.
As far as the appointments, she has a very good system and it works. Again, the only thing we have to be concerned with is having enough of space so that people can have the time to wait after their shot and have the spacing and everything else we need. But the gym should allow us to do that, especially with appointments.
Yeah. Okay. I was just worried that if we posted it on a Monday, that we were going to have it that following Saturday, that we wouldn't have enough time for people to sign up.
No, we could give it a week or two. I mean, it's fine. Again, at that point, once we receive the vaccine, Nancy will already have the forms and they will be posted online. She can post them online.
Right.
And
Okay.
people can prep that.
Yeah.
So we minimize the amount of time that people have actually in the gym area.
Right. Right.
Most certainly, if people don't have access to a computer or printer, we'll have forms available. And it shouldn't be that difficult to get everyone in and out in, 20 minutes, 25 minutes, including a wait time if they so choose to wait. A lot of people don't choose to wait.
I know.
So that would still be the 50 minimum in the gym. 50
Correct.
people.
And that would
Okay.
include any staff that you have in the gym. So we have to take that into account.
Okay.
Then hope they don't change that limit.
Yeah.
Well, if they change the limit, we all have control over that limit being dropped. If everyone does what they need to do, wears masks consistently, maintains social distancing, and washes hands, we'll keep the numbers down. I mean, Grafton has had some, you have a very low number of cases. I mean, 102 cases is not too bad.
Right.
And you've had, zeros for a couple of weeks now. So
Yeah.
we can hopefully keep it that way if everyone continues doing what we're supposed to do.
Exactly.
Fingers crossed. All right. Anything else anyone has on the flu clinics right now, at least? All right. If not, then like I said, we'll move the back to school timeline and information up next, because with Pat joining us, because I know a couple of the questions that Jay Cummings had were something that I think would be good to run by Pat. So Dan, you've been the one having the bulk of the emails, conversations, et cetera, back and forth with Jay Cummings. So if you want to get
Yeah. I did attend the meeting, and obviously Pat was there, and Phil and Jay Cummings and Becca was it Wednesday, I think, with the Alliance. And it turned out to be a little more of a meet and greet. Pat had a lot of good information, but at the end of the day, the Alliance said, well, we're going to come up with more guidance. And I think that's, at this stage of the game, that's what Jay is looking for, because I did email him just this morning and for some parameters and things that he had in place. And as it turns out, it's a pretty amazing plan that he has put together. And I didn't even get to have a chance to go through it all as well yet, but he did say he's looking for some help with the contact tracing and the testing. And if it's not available, if there's any additional training of the medical staff at the schools.
I think
Okay.
his question was, who does the contact tracing? Is it the Alliance, is it the state, or is it going to be his staff at the schools?
It will be the Alliance will take the lead. It will be a collaborative effort. Most certainly, we will do the initial contact of the parents of the child and place the child in isolation and the parents and any other household contacts in quarantine. That we will then work with the school to determine who at the school would be considered a close contact. And then we will work with notifying them, very similar to what we would do in the schools with the pertussis exposure.
Yeah.
Where we work very closely with the nurse in that school, determine who had contact with the person, and then, send out appropriate notification. Most certainly with this, you have the DESE guidance to take into account. I did read, again, part of the plan. I didn't get through all 38 pages. But I mean, they do have it's a very comprehensive plan from what I could see. You're going to have 2 cohorts, cohort A, cohort B. And then of course, people who choose to stay home, whether it be, for the fall semester, waiting to see what happens. So you're going to have decreased numbers in the school if people most certainly do what they're supposed to do. And if we can maintain 6-foot distancing as much as possible, and everyone, again, follows the guidance and the direction of the teachers in the classroom, we can minimize the, people who are exposed.
And this is Dan, just another question. I saw that the deadline for providing a plan is the end of this week, and I think Jay's going to be able to do that without much difficulty. But when does school actually start? Is it after Labor Day or the middle of September? Is it pushed out that far?
It's pushed out to the middle of
I
September.
thought it was
from what
September 16th or something like that.
Okay.
Yeah. It's much later than usual to allow for the teachers to have in-servicing.
Yeah.
And I think Jay's other question was more around saying, this is obviously Dan, jump in. I'm just looking at the emails around like state guidance refers to testing often, but as we know, testing is not always easy to access. And, by the time you get results back. So I think he has some concerns potentially around there about, how long it could take, et cetera.
And again, that's the $1 million question. Most certainly, if you're identified as a contact to a case, you are mandated, that the guidance says you must get tested and, quarantine until you get that test result. And, if it's negative, you can come back to school with proper masking, et cetera. I believe, I didn't go through the whole graph plan from the superintendent. I didn't get through it all. If they're following DESE guidance, that's what it says. I mean, if they choose to follow Mass DPH guidance, the child would be out for 14 days. Again, if we maintain social distancing and masking, we can, minimize the number of people who are out. As far as testing, people can work with their PCP. If they're a contact to a case, we do have notifications that we do send out that will say this person has been identified as contact to a case, and testing is mandated, so they don't have to worry about being symptomatic and getting that test. Again, labs trying to build capacity. Most certainly, the more tests that are being done, the longer it may take for some results to come through. But right now, some providers, we're getting them the next day. Others, it is taking 4 or 5 days. In some instances, it has taken longer, but the person is out until we have that test result anyway.
Yeah, excuse me, I've heard 2 to 4 days is an average right now, but Pat, here's a question. How many folks on your staff that are going to be working, and how many school districts do you have?
We have 4 school districts besides Worcester. Well, Worcester has their own nurses. We have 4 school districts that we provide public health nursing services for. So Grafton, Leicester, Shrewsbury, and Holden.
Okay.
And most certainly we work very closely with the public health nurse in Millbury and in West Boylston.
Yep.
Kat, will
But
there be a list? I know this, I read somewhere where the doctors are telling the moms and dads to call the Board of Health. And we are going to need to know where to send them. Where can they get the free testing? That's a big question too.
Okay, if you go to the mass.gov testing website, everything is listed there. They can search by zip code, and it will give you whether the tests are free or if there are any other parameters. But, if they're a contact to a case, that's why we have that letter from Mass DPH that says this person has been identified as a close contact. And most certainly I'll make that available to the school nurses and, work very closely with them to help alleviate testing issues. But the first point of testing should be the person's PCP.
Okay,
And otherwise, consult the Mass DPH testing website.
okay, thank you.
Yep,
You're
thanks.
welcome.
Is there anything else, Dan, from conversations?
No, not at this time. We'll just cross our fingers. I think we are in a pretty good area personally that, it's not a high incidence to begin with. And I still think it's important. I mean, I'm just voicing my opinion. I think junior and seniors in high school could get by with virtual learning, but for the kids in the lower grades, it's so important to have that personal contact. I mean, you can't teach a child to read or write over a computer, so it's worth a shot.
And most certainly we'll work with you and watch the number of cases that are being reported in the schools and help you to, mitigate the spread. And, we will guide you every step of the way. Again, as I said, everything is nuanced. It's going to depend on people wearing their masks, keeping that distancing. I've had conversations with some of the other school districts around ways that you could help assist the teacher in keeping track of how these different things are being monitored during the day, whether it be mask wearing or social distancing, hand washing, cleaning surfaces and whatever. And one of the things we need to be concerned with is if somebody develops symptoms, we're going to be looking back 48 hours prior to that symptom onset. So it's very important that we get accurate information, especially in the lower grades. We really need to rely on that teacher to tell us, okay, what did you maintain social distancing in your classroom? Were all of the children masked, or at least if somebody couldn't wear a mask, was everyone else around them masked? Not that puts it to zero, but it does help. And then were people, doing what they were supposed to do when they were, getting up or to, go use the restroom or whatever they need to do. Were they making sure they weren't face to face with anyone for 10 to 15 minutes? And that's something we can, I can discuss with the school nurses directly.
Great.
Austin, any questions?
Nope. Looking forward to see how this all plays out once kids go back to school.
Again, we are there. We will help guide you through it. And again, it's
Thank you.
very situation specific.
Yeah, absolutely. Day by day.
Mhm.
Thank you.
You're very welcome.
Dan, when you speak with Jay,
Yeah.
can you get the name of the nurse that has taken over for Seal Thurber? I don't want to keep bombarding Jay with a lot of emails.
Sure.
Thank you.
Now, is she the only nurse in the Grafton schools? Or are there more than one?
No,
No, there's many nurses in the Grafton schools.
Okay,
but Seal was like the one that the nurses all reported to. She was like
Right.
the head nurse.
right. Sure, I'll ask him about that.
Thank you.
I don't have any further questions right now, so thanks again, Pat, for
All right.
joining us.
You're
Feel
very
free, you can
welcome.
stick around, or I just didn't want to force you since the topics were, towards the end.
No, that's fine. I was fully prepared to be on for 4 hours, but I'm very grateful for your consideration.
Well, thank you again. Thank you for everything you've been doing. I know it's been a
You're
trying
welcome.
time for everyone.
Yep,
Okay,
thanks, Pat.
And if anyone has any other specific questions, feel free to email me. I'll answer them for you. Sometimes it's easier to have a conversation about it, whatever works best for you, but I'll be more than happy to answer your questions.
Great, thanks.
All right.
You're
Thanks
welcome.
again.
All right, thank you. I'll leave the meeting now. Have a good evening.
Thanks, Pat.
Thanks. Bye.
Thanks, Pat.
Bye.
I'm still on. If you need me, do you need me for anything more?
Let me check. I mean, COVID, actually, you can see.
Did you guys have any questions about the housing complaints or anything like that? I mean, it looks like they've sent letters out to everybody, so it looks like
Yeah. Yeah, I was just scrolling through to make sure there was nothing else.
Oh, the only thing you will need to put under new business.
Oh, yeah, I have
needs
that.
to- The FEP letter, right.
Yeah.
And right now it's Phil and Dan. So now the new one will be until June 30th of next year.
That's still okay with me. If Phil can take the lead, I can be the backup. If that's okay.
Yeah, what was that for?
For the
That will-
FEP representative.
Okay, yeah, no, I'm fine. I'm still doing that for sure.
Okay. Yep.
thank you guys.
So there,
Yes.
you just gotta make sure you send the letter.
Yeah.
If you haven't already.
No, I haven't. That's why I needed a
Okay,
motion.
yep,
All right, so well, let's just finish that one up then. So we need a motion for FEP representative and then a second, and then we vote.
I don't know if I can, not really nominating myself, but I'll make a motion that Phil Legier is the primary FEP representative for this coming fiscal year, and that I, Dan Finn, will be the second or backup position as a representative.
alternate. They
Okay,
call it alternate.
let's call it an
Yeah.
alternate.
I'll second that motion for Philip Leisure as the primary FEP representative and Dan Finn as the alternate representative.
All right. So we have a motion and a second. Can we have a vote?
Sure. Dan Finn, aye.
Austin Magnan, aye.
Karen Gwasowski Govin, aye. All right, so got that done. All right, so I'm looking through the rest of the agenda. I don't think there's anything else because like the COVID related stuff is just going to be pretty much a repeat of what we had during this morning's meeting, just at a quick update and everything, but nothing that there would probably be any questions for. So Phil, if you want to get going, because I'm sure you've got plenty to deal with also.
Like supper.
Okay. Yeah, supper, I just got home, so. All right, thank you.
Yep,
You know how to get a
thanks.
hold of me.
All right,
Okay, bye.
thanks again, Phil.
Bye.
Thank you, Phil.
Bye. All right, so back to our order here. So coronavirus COVID-19 updates. So as of today, since we've got the numbers in for today, Grafton's been informed of a total of 102 confirmed positive COVID cases. And that's a rolling total since March. Then just briefly on some developments that have happened at the state. On August 7th, the state announced that step 2 of phase 3 is now being delayed indefinitely due to concerns, especially with Governor Baker was mentioning a lot about gatherings being larger than they're supposed to without social distancing, no masks, et cetera, et cetera. And so the cases have been at a state level, not Grafton specific, creeping up here and there, and they've started to see some clusters developing from some of these gatherings. One of the ones that he mentioned was there were a couple large weddings out in Gardner at a hotel recently. One was like 190 people and one was almost 300 people. So that facility is getting some good fines, it looks like, because of that, because they'd already been warned in advance that they can't have those weddings, and then they proceeded to have them. Let's see, outdoor, and Phil touched on a few of these already. Outdoor gatherings have been cut from 100 people to 50 people total. So if that gathering happens to have some type of staff to it or workers, that includes those workers are in that count. And whoever is attending it or patrons, etc. Indoor gatherings are being kept at a max of 25 people for now. And that 25 people also includes workers and attendees. This was clarified to also be for public and private property. So that includes people's backyards, front yards, streets, whatever, houses. Those gathering limits apply. Indoor and outdoor gatherings must have individuals maintaining 6 feet minimum between individuals from other households, unless it's not reasonably possible. Face masks or coverings are now required at gatherings, both public and private, when there are more than 10 people together from more than one household. People who host events, public or private, that exceed these gathering limits or aren't doing it with the appropriate social distancing, mask wearing, et cetera, will be subject to fines and penalties. State and local police have now been authorized to enforce COVID-19 related orders. They can issue fines, et cetera. On the restaurant front, this was all on August 7th. It was a busy press conference. The restaurant restriction guidelines were clarified further that, as Baker called them, bars masquerading as restaurants should not be open. He mentioned places that are pretty much bars that have started to serve pretzels and chips, prepackaged, manufactured foods. He said those are not supposed to have been open, but the clarification didn't exist in the guidance, so now it does. So they would need to shut because they would fall under like the bars, which are phase 4, which, as a reminder, that Baker said, phase 4 will not happen until there's a vaccine out there or an effective treatment. So TBD on that at this point. These, or any bar, restaurant, brewery, brew pub, whatever you want to consider them, winery, must be serving food that's prepared on site. Another big clarification was that alcohol being served at restaurants can only be served if the customer is ordering and eating food on site. So you can't just go to a restaurant or a brewery or a winery, order a drink and not order food. People were getting around some of the restrictions thinking they could do that. So that's been clarified also. And there was a communication that we sent out on the local side to the restaurants with that clarification and some reminders on other things such as live entertainment restrictions, et cetera. So we wanted to make sure that was communicated. We're not saying anyone was doing that, obviously, but since the state clarified it and made it much clearer, we wanted to make sure that was communicated in case people didn't watch Baker's press conference or see it in the news. Obviously, as we've mentioned every time, and as Pat and Phil have mentioned, requirements around social distancing and wearing a face mask are still in effect. Overall, Massachusetts has been doing a very good job with COVID-19. So hopefully everyone will continue to do the social distancing, not have large gatherings, wear masks, frequent hand washing, staying home if feeling sick, et cetera, everything we've been told since March to do. And that the businesses across the state, not just Grafton that we're primarily focused on, will comply with the restrictions, because we need to do what everyone needs to do their part to make sure that we're protecting citizens, employees, employers, young, old, and in between, because we don't want this to get worse, and we don't want to have the government roll back even further, because no one obviously wants that. And that's, what Pat was saying earlier, like we just have to keep going the way we've been going. And at some point in time, this we'll get out on the other side finally. Anything else? Dan, Austin, did I miss anything?
Yeah, just the other thing is that the state created a COVID enforcement and intervention team that's gonna focus primarily on sites where there's large clusters of cases, but it's a cross-agency team that's gonna focus on enforcing the guidelines, and it's also going to include the state ABC commission, as well as the police and various other agencies, to try to stem the spread and keep everybody in line in regard to restaurants.
All right. Next topic was the weekly Board of Health Department head Zoom meetings, which the biggest update is obviously we're continuing them, but we switched them to bi-weekly at this point. We just had one this morning, just as an ongoing touch point for the various parts of the town, whether it be school, police, fire, town administration, select board, MRC, CERT. We have Meridian and more join if they're available. It's just a place, where we, like today's big topic was obviously everything that transpired on Friday with what Baker's announcement was. It's also a place where we go through and we review complaints, concerns, new ones, existing ones, follow-ups that are needed. We started to talk about elections, town meeting, fact that there's nothing new from a guidance perspective than there was when we had worked on the previous recent town meeting and the recent election, at least from a COVID perspective. So we're kind of in the same place from a COVID guidance perspective on, how we're going to have to think as a town about handling both elections and town meeting that are coming up. Not saying that state won't come out with something more, but at this point in time, we haven't seen anything come through. So I foresee we'll continue those meetings for a while, to say the least. All right, next topic, the Tripoli and West Nile virus updates. So this was a topic last monthly meeting. Just the reminder that Tripoli and West Nile season are upon us, and so is tick season. There have been a variety of Tripoli and West Nile positive mosquitoes across the state. So far, none around here. There's also unfortunately been the first human cases, one of Tripoli and one of West Nile in Massachusetts for 2020. Similarly, not near Grafton, but it just goes to show that this is probably going to be as predicted, higher year from at least a Tripoli perspective, because it would be the second year of that typical 2 to 3 year busy Tripoli season that they typically see from a cycling perspective. So mosquito surveillance is, ongoing. People are reminded to be diligent when you're going outdoors, especially in the evenings. Use bug repellent while you're outside. Make sure you're checking your property for sources of standing water that could have a breeding area for mosquitoes. We have a bunch of resources on our Board of Health website around the services that Central Mass Mosquito Control Project, CMMCP, offer, whether it be tire pickup requests, spraying requests, and then we also have the exclusion form. So if you don't want your property sprayed, you can fill out that form. One follow-up from the last meeting was we had received a complaint on Wesson Road, where the Mosquito Control Project and the town were notified that mosquito spraying had occurred in the area, and there were concerns that that might have caused some die-off from a beehive in the Wesson Road area. Since then, the state and Mosquito Control Project have conducted their investigation, and the state came back saying that there were no pesticides detected in the sampling of the bees taken from the beehive location on Wesson Road at the time, obviously, of said die-off. So that was the results of that investigation. All right.
We have links to the Central Mass Mosquito Program opt-out form on our website.
Yeah, that's the exclusion form.
Yeah, okay, we do have that linked on our website.
Yeah.
Okay, great.
All right, what's next? All right, Board of Health member vacancy. This is just a brief update. So the Board of Health, we had completed our reviews and interviews of the applicants, the 6 applicants, and we provided our recommendation for our top 3 applicants, and that was provided to the Select Board. The Select Board last week started their interviews during the storm that we all experienced. They did 2 of the 3 applicants were able to attend. One was unfortunately unable to attend due to no power, internet, etc. The last interview is scheduled for tomorrow night's select board meeting. And from there, they'll make their choice for who will be appointed for the Board of Health vacancy.
Karen, could I interject something here? I just thought of. Could I make a motion that we postpone the reorganization of the Grafton Board of Health in terms of positions for another month until we have a full board?
Yeah, that's why it wasn't on the agenda.
But we postponed it last month.
Yeah.
Okay, no, you're right. We don't have to do it because we said until that point. I thought
Until
we
we
did.
had someone, yeah.
Okay, then I withdraw that motion.
Because I thought of it when we were putting together agenda. I'm like, wait, we said we were going to wait until we had the
Yeah,
person.
that's correct.
At
Never
the
mind.
time, we didn't know what the timing was going to be. So,
Right, never mind.
next topic, since we had already done the flu one, was the tobacco regulations. With this, I don't know if the board members had a chance following last month's meeting to review the current Grafton tobacco regulations compared to the Massachusetts revised tobacco regulations, to see, is that some type of action that we ourselves can do to take, the pieces that are still out there from the Massachusetts and incorporate them into the Grafton ones. Get any type of, do we need any assistance from town council? Do we want to have the alliance do that? So that was kind of coming out of our last meeting, was if board members had time to review them, if we thought that was something we could do ourselves or not.
This is Dan Finn. I must admit I did not have time, or actually just did not realize we were going to look at that. So I think we should talk to the Alliance, and maybe at the next meeting, we can put it back on the agenda for some more input.
Yeah, during our last meeting, did we talk about the Alliance maybe taking the lead on that, or did we push that off until we decided?
We said we were going to review to see if it was something we could do ourselves or not.
Yeah, I haven't had a chance to review them to see if I.
But then you received an email back from Jocelyn, who's not there anymore.
Right.
I believe she said something about town council. I'll have to check for that email tomorrow.
Yeah. I mean, if they're straightforward enough, I don't mind us attempting to do them and then sending them to town council to make sure that we didn't, for lack of a better term, mess up anything or miss anything, if the Alliance can't do it. I think the original plan before Joshin was leaving was that the Alliance would do it or assist, not saying they would do it 100%, you know what I mean?
Yeah, I still think we should table it until Austin and I and hopefully Josh have more time to look at them. Is there a deadline on it, or can we wait till?
I think, yeah, I don't think there's like a true deadline,
Right.
as such. So
Okay.
last I heard, not everyone, and by everyone I mean other towns in Alliance, hadn't gone through and done their updates yet and accepted them. So, and some of what's in there in the state, I know we already have. But it's a matter of, because you can remember we have 2 regulations related to tobacco on our side of the world, and then the state's got, there's a bunch of them. Let's put it that way, if you look at their website on the tobacco regulation. So it's a matter of taking all the pieces and parts and comparing them to ours. All right, so we will move that to the next one. So that leaves on the topics that we haven't touched on the agenda, the plastic bag ban enforcement. So Dan and Austin, as I'm sure you're aware, there's the plastic bag ban that was passed, and then it's, even though the Board of Health was not the one who actually developed the ban or the regulation, we're the ones who are the enforcers of said regulation. So back when COVID hit, the state had said you cannot use reusable bags when you go grocery shopping or etc. So they put the restriction in place that you could not use reusable bags during the, height of COVID. And there also, they said that towns and cities who had plastic bag bans, such as what we have, could not, penalize stores, or have stores could not penalize customers, because some places charge, say, 5 cents for a plastic bag, that type of thing. So they pretty much said anyone who's got a ban out there, or anyone who's got a policy that you can charge a customer for a plastic bag, we're overriding that as a state, because we don't want people to be using reusable bags. So let them use paper, yet let them use plastic at this point in time. Since then, recently, the state has pretty much come back and removed said restriction on reusable bag usage. And also is pretty much like, okay, if you want to start up your plastic bag ban enforcement, you can. Our pause, few cities and towns, has been removed. So now we have to decide, like other towns are, because I've heard other towns are doing this in cities. We know we have facilities, we know we have stores, restaurants, etc. in town, just like every other town does, that purchased who knows how much of a quantity of plastic bags when the reusable bag ban came into place. Most cities and towns seem to be giving some leeway, a grace period, shall we say, for the facilities in town to kind of use up those plastic bags and not make them have to toss them or lose out on being able to get through their inventory. So pretty much at this point, we have to decide, are we going to do something similar where we're going to say, in X amount of weeks, months, we'll start reinforcing the plastic bag ban in town?
Yep.
And if so, what's that date going to be? And then we obviously have to communicate it out afterwards once we make a motion and a vote.
I would say at least a month after our next meeting, probably a month and a half, maybe shoot for mid to late September. People enough time, and businesses enough time to start warning people that they're going to get charged again, and tell them that they can start bringing their reusable bags if they want, if they don't already know.
Yeah, this is Dan. I'd say 60 to 90 days actually, but to get the word out that, as it is, I think a lot of small businesses are still struggling, and they probably do have inventory on hand.
It might be slow right now due to everybody staying at home, so that's a good point. Maybe
And as opposed to having to go out and buy paper bags, which are more costly, I don't know. That's kind of a time frame I'm thinking is 60 to 90 days, and sort of get the word out to them to prepare for that decision.
Yeah,
What do you think, Karen?
I'm just looking at the calendar, like figuring out what that would be.
Yeah.
So if we go somewhere, so like 80-ish days, because we're partway through August at this point,
Right.
would be the end of October. Do we want to say something like November 1st?
Yeah.
Yeah, I think that's reasonable.
I like
All
that.
right. All right, so then if we're good with that, then we need to motion, a second, and a vote.
This is Dan Finn. I'd like to make a motion that we reinstitute the enforcement of the plastic bag ban effective November 1st, and that we publicize that decision as soon as possible to the local businesses in the town of Grafton.
Austin,
Yeah.
I'll second that motion to start the plastic bag enforcement on November 1st.
All right. All right, can we get a roll call vote?
Dan Finn, aye.
Magnet, aye.
Karen Gwiazdowski Govin, aye. All right, that is passed. Thank you. All right, so we did the school, we did the new business. So I'm just double checking the agenda since we did take a couple things out of order. I want to make sure we didn't bypass anything by mistake. No. Is there any other old or new business?
No, Dan Finn, I can't think of any.
Mr. Magnet says he can't either.
Any mail or correspondence, Nancy, you haven't already sent over to us?
Nope, you have everything.
All right, thank you. All right, so then upcoming meetings, which I will caveat that we discovered there's an overlapping issue with the next 4 out of 5 of our 5 meetings because normally we're on the second Monday of the month, which for September 14th we are also, but recreation because of Labor Day moved out to, instead of the first Monday of the month, they moved out to the second Monday of the month. So they start normally at 7. We start at 6:30, but then because we get stuck with both Columbus Day and town meeting, we decided on the first Monday in October. And then because we didn't want to space it out more than about 4 weeks, we're now overlapping our September 14th, October 5th, November 2nd, and December 7th meeting with the Recreation Commission. So I know Nancy, you had put out an email to Becca to see if there's any way there can be, say, another Zoom account created or something, because this is not the only time that we've run into issues, but I know others have run into issues where there's overlapping meetings, and it's hard, obviously, with getting everything rearranged with various boards and work schedules and everything. So, I mean, as of right now, I say we keep the dates that I just listed off, but we'll follow up with Becca when she's back to see what's possible because, you know, we cannot go, especially with COVID, let alone EEE season, flu season, and then an upcoming upcoming COVID vaccine. We can't be going more than about 4 weeks in between meetings at the most.
And as another thought, possibly for the next month, if we could start at 6 and they could start at 7:30 or vice versa,
Yeah.
we might, cutting it to an hour might be a little close, but we can maybe work something out like that and
Yeah.
be flexible.
That's, trying to figure out, like, if for some reason another Zoom account is not feasible, could we start doing like that? Like you said, we
Yeah.
start at 6, we promise to be out by 7:20, gives them time to jump on at 7:30. So we'll figure out something that hopefully doesn't cause us to have to change days, because October, it's like next to impossible for options pretty much based
Right.
on the holiday and town meeting, because that's what got us messed up.
Right.
And that happens every year, but we've just never run into a problem because normally there's rooms we're talking about and there's at least 2 rooms, whereas we have a Zoom account.
Yep. And our agendas seem to be getting longer pretty
Yes.
consistently. So it used to be within an hour, but now it's closer to an hour and a half, I think, perhaps. But
We'll figure something out.
Right.
All right. So that's all we had on the agenda.
This is Dan Finn. I'd like to make a motion to adjourn this meeting.
Austin Magnet, I'll second that motion to adjourn the meeting.
All
Dan
right,
Finn-
all
Dan
in
Finn, aye.
favor? Oh, sorry.
Jumping the gun. Austin Magnet, aye.
Karen Gwiazdowski Govin, aye. All right.
Have a good night, everybody.
You
See you
too.
tomorrow. See you tomorrow night, Karen.
Yes.
Have fun.
All right. Good evening, everyone. Thank you.
Thank you.